Well, I'd been feeling sick all through Easter Friday and Easter Saturday, and finally we called the ambulance on Saturday night and went into the hospital, and it was very busy. Well, we got in there about 10 o'clock at night, so it was 5 or 6 o'clock or even later the next morning that before we got admitted. We had a lovely nurse, but she was just run off her feet, and eventually she actually apologised to me for not being able to be there as much as she would have liked, because she said she had 6 patients to look after, and she said really, as sick as I was that night, she should have really only had 2 to look after. And she said that there'd been 32 patients on that Saturday night that they had to cope with all at once. You'd press your button and you'd wait quite a long time, and a nurse would go flying past the door and didn't even have time to stop because they were just so flat out all the time. The nurses would be lucky to just do their obs and then they disappear because they're too busy elsewhere. We live near Foster, which is a big tourist and family holiday sort of place, and so there's a lot more people, a lot of retired people, and so sort of a lot of older people. So we need the doctors and the nurses to look after those people. There definitely should be extra staff at the busiest times or when nurses need to have breaks, which they need too, and then they won't be so overstressed. We don't want them to be so burnt out that they give up the profession, because we really need them. And they don't want to be so exhausted that they can't do the job well either, or end up making mistakes. And we want our young people to want to go into nursing. We really need nurses working in an environment where they can do the job that they're being paid to do and not feeling like they're only doing half a job because they just haven't got the time to do it right.